Are you suffering with incontinence, some leaking, some dribbling, some difficulty fully emptying your bladder, only to stand up and find out that a little bit more is coming out and you don't know what to do about it? Then today's video is for you. I'm Dr. Amy with Physical Therapy for Everybody, and today we are talking about incontinence, the thing that nobody wants to talk about, but so many women are suffering from. So many women I know have to wear a pad if they're going to run or jump or do any jumping jacks or any kind of high intensity exercise, or even if they're going and jumping on the trampoline with their children or their grandchildren. And it doesn't have to be this way, ladies. There's no reason why you should have to wear a pad just because you've had children, or just because you've gotten older, or just because your body has gone through some changes. And even if you've put on some weight and you've been told that all of your problems are due to that, I'm here to tell you they're probably not due to that. There's probably something else going on that you can do something about, so you don't have to worry about leaking in uncomfortable situations. So today we're going to talk about the top 5 tips that I recommend you do to eliminate incontinence. Ready? Here we go. Your first tip is to do the right exercises. Now I know you're probably thinking, oh, I've been doing Kegel exercises and they don't work. And I would agree with you. Kegel exercises do not work. Do you want to know why? Most of the time the problem is that your pelvic floor is already too tight. Then you do a Kegel exercise and try to make it contract even more. Well, I mean, that's impossible. When a muscle is fully contracted, it cannot contract anymore. So you're trying to do this exercise, you don't know if you're doing it right, and you're not seeing any benefit from it. What you need to do is an exercise that teaches you how to contract, but also relax your pelvic floor muscles, because it's only when they learn how to relax. And by relax, I mean a normal relaxation, right? Obviously your pelvic floor, we don't want it to totally relax. I mean, then everything's gonna fall out. That's no good. I understand that. But what we're trying to do is get a proper contraction and a proper relaxation, so that when you do a higher level activity, like jump on a trampoline, jumping jacks, running, things like that, you don't have issues with leakage. So if you wanna know the exercise that I most often recommend for ladies, you can click on the ebook link below, and it's How to Stop Peeing When You Laugh, Cough, and Sneeze. And it will show you the exercise that I have found to help so many women who are struggling with this problem. In fact, I even had one patient, I wasn't even treating her for her pelvic floor. I was actually treating her for her neck. And she happened to mention that when she went to Seahawks games, she would jump up and everything would come out. But she was a very enthusiastic fan, and so she could not stop herself from jumping up when she was at the Seahawks games. So she was really embarrassed, and she had to bring clothes to change into and everything. And now, mind you, lady, she's wearing a full Depends, not just like a panty liner. She is wearing a full-on Depends, and she's still leaking in her pants. So I gave her this one simple exercise. I didn't even look at her pelvic floor. I just gave her this one simple exercise. I told her to do it for a month until I saw her again. And then if it didn't work, then we would go ahead and do a full evaluation and figure out what was going on. She did this exercise twice a day for an entire month, and her symptoms decreased dramatically. Now, she still wore the Depends to make sure that everything was safe whenever she was at a football game, but everything would stay in the Depends. So then after the game, she could just take it off, throw it away, and boom, she was done. She was so happy to be able to do that. And I told her, if you continue to do the exercise, you'll continue to see more and more benefit. But after a month, she stopped wetting her pants. That's a pretty big accomplishment for just one very simple exercise. And like I said, it's described in the ebook. So I highly recommend you click on that link, you get that ebook, try the exercise, try it for 30 days, and then let me know how it works for you. All right? And no more Kegels. Let's stop doing Kegels. Kegels are not good for you. Let's just stop doing Kegels. All right, thanks guys. All right, you ready for tip number 2? We need to strengthen those hips. So your hips are very, very important because the pelvic floor actually attaches into the deep hip internal and external rotators. So hip internal rotation is your toes pointing towards each other. Hip external rotation is your toes pointing away from each other. The pelvic floor attaches into these muscles, which means when we're strengthening our hips, and also when we're walking, which we're going to talk about later on, it's activating the pelvic floor. It's causing a passive contraction and relaxation of the pelvic floor. So strengthen your hips and you strengthen the pelvic floor. And it's much easier to strengthen the hips, right? Because you can do all kinds of different exercises to work on your glutes and the hip muscles on the side. All of these muscles can get stronger and cause that pelvic floor to have more control naturally. Plus, then you have stronger hips, and so it's easier to do those other activities that you want to do anyway. Tip number 3, I want you to work on your deep abdominals and your low back muscles. So the pelvic floor works with the deep abdominals and low back muscles, and they're like a triangle. So if one of them is weak, like let's say your abdominals are weak, that is going to increase stress to the pelvic floor because somebody's got to take up for it. So those 3 work together and make that triangle, and you can't have a full, complete triangle if somebody's working too hard and somebody's not working enough. It makes a lopsided triangle, which is not what we want. So most women, I find their backs are actually strong enough. It's those deep abdominals, not necessarily the upper abdominals, but those deep low abdominals that attach to the pubic symphysis. That's that bone in the front. Those muscles that attach down there that are weak, they've probably gotten stretched out either over time or due to weight or maybe a pregnancy, and they're not able to contract and hold that core in and provide enough support. This puts more stress on the pelvic floor, which makes it have to work harder, which makes it tighter, which makes it more difficult to control when you're doing higher level activities like coughing, laughing, sneezing, jogging, and things like that. Tip number 4 is also super critically important. I need you to make sure that you are treating your constipation. So if you are constipated, that puts increased pressure on the pelvic floor because all of those organs are in the abdominal cavity, which is above the pelvic floor. Now, what is the definition of constipation? This is highly debated in the literature, but my definition of constipation is you should be pooping every day and it should look like fat snakes. So if you have like little rabbit poops or you're not pooping easily every day, you need to get to work on that. Now, it may require having more water, it may require having more fiber, it may require having more electrolytes. There's lots of different reasons for constipation. It could be the food that you're eating that's causing it. It's probably dietary related though, right? Why you have that constipation. You need to figure that out and make sure that you resolve that to decrease the pressure in your abdominal cavity. Now, if you've already tried that, you do the fiber, you do the coconut water, you've done everything and you still suffer with constipation, then you probably have a restriction in your abdominal cavity where the organs are not able to move properly. So when they're not able to move, and I don't mean they move all over the place, right? Your organs don't travel all over your abdominal cavity, but they breathe. They have to be able to expand and contract, right? That's what moves everything around and out of the body. If they can't expand and contract, then things get stuck. And when things get stuck, that causes constipation. So if you've tried everything and you've done all the internal things and you're still not finding relief for your constipation, then you need to see a manual physical therapist who specializes in visceral mobilization. Viscera is the organ, so that's what we call it when we're manipulating the organs and freeing them up so they can move better. The last tip that we're going to talk about today, if you're struggling with urinary incontinence, is to cut down on the caffeine. Now, I know I live in the Seattle area. I'm not saying you have to get rid of your coffee, friends. That would be hearsay. That would not go over very well. But maybe cut it in half. Cut the quantity that you're drinking in half because it is a stimulant. It does irritate the urinary tract system and it can make it more difficult when you're dealing with things like incontinence. Here's the deal. Try cutting the amount of caffeine you drink every day in half for 30 days. If you implement all the other techniques and you don't notice any change, then it's safe to say that the caffeine is not actually affecting you and you can go back to what you were drinking before. But maybe it does help. It's not gonna hurt, I promise. It's not gonna hurt. You can still drink your caffeine. just cut it in half, just 50% of what you drank before, and notice if there's any changes in your incontinence issues. So what are your incontinence questions? Hopefully we've given you some great tips to start on your journey today. If you've already tried all of these things and you are still struggling, I definitely recommend seeking out a physical therapist who's manual therapy trained, who has pelvic floor training, who understands visceral mobilization, because you are having a difficult issue that needs help to figure out the entire answer. I'd love for you to check out this video over here to learn more and click subscribe because we drop videos a couple times a week. Have a great day, everyone.